Greetings and thanks for tuning in today. My name is Dr. Jeanette DeWitt. I am a doctor of physical therapy and a chronic pain specialist. I am going to answer one of the most common questions that I have received since practicing since 1998, and that is, when I hurt, should I go to the doctor or will it get better with time? Now, I'm definitely going to answer that question, but first I want to say that if you are experiencing the following symptoms, you absolutely have to go to the doctor immediately, preferably the emergency room. And that would be shortness of breath, chest pain, symptoms going down the arm that along with the chest pain, loss of bowel and bladder, those type of things, including foot drop, are all symptoms and signs that you need to go to urgent care or the emergency care department. Now, if you are experiencing the following symptoms, I highly recommend you do go to the doctor. And we'll talk about the time thing in a little bit, but if you are experiencing symptoms following an injury where that injured area is red, is really painful to touch, is swollen, it's keeping you up at night, and you're finding it difficult to put weight through it. So that means you can't lean on your arm or you can't put weight down to walk normally because you're experiencing sharp shooting pain. If you are experiencing those symptoms, you definitely want to go to an urgent care or a sports medicine walk-in clinic, something like that, because you probably need an x-ray to rule out a fracture. Or you might even need an MRI to rule out any type of major rupture or tear of a ligament or a muscle. So those would be the signs and symptoms of really needing to go seek medical care within either immediately or within 72 hours. So look at those symptoms and signs. If you're experiencing any of those, you absolutely should go to the doctor to make sure something major is not going on. What about the ache or pain that you don't feel too bad when you're resting, or if you're standing in place, you don't really feel too bad, but it hurts when you sit down or lay down, or maybe you have more pain when you're sitting down or lay down, and maybe it's the opposite of that, and you get relief when you sit down or lay down, but you can't really stand for long periods of time. These are kind of achy, soreness type symptoms. They're questionable. They're not really sharp and shooting type pain, but you definitely are restricting your activity, or you are thinking twice about doing your normal activity. If you're experiencing signs and symptoms like that, you might have a mild sprain of a ligament, or you might have a mild strain of a muscle or tendon. And the question is, will it get better with time? Soft tissue injuries do get better with time. They do heal over 4 to 6 weeks, typically, especially if it's not a complete tear or if it's not a bone break or a stress fracture. So if you're experiencing kind of achy soreness, maybe you mowed the lawn for the first time, maybe you did cardio cleaning over the weekend and you wake up Monday morning and you're just feeling, oh man, I feel like I pulled my back, or oh, I feel like I slept on my neck wrong, or ouch, my calves and my hamstrings are really, really tight. Yes, that can get better with time. In fact, if you notice that your symptoms are improving over 3 to 5 days, you're probably okay to just take it easy and let nature run its course. However, if you are still experiencing symptoms within 7 to 10 days, you definitely should have a specialist look at that. Now, it could be a primary care doctor, it could be an orthopedist, it could be a chiropractor, physical therapist, or massage therapist. A specialist needs to be the one to take a look to determine if you've done something more than just a mild strain or a mild sprain. From a physical therapy standpoint, because I'm a doctor of physical therapy, I will say that the research shows that if somebody gets injured and sees a doctor of physical therapy within 7 to 10 days of injury, they are more likely to not need pain medication, they are more likely to not need surgery, and they are more likely to recover faster than the person who puts it off and thinks that time will be on their side. Now, for those of you who go to the doctor and the doctor says, rest, there is some truth in that. Sometimes something does need to rest. That's where we get RICE, which stands for rest, ice, compression, and elevation. Rest is a good idea when it comes to an area that's swollen, when it comes to an area that needs to be elevated and needs to have weight put off of it. However, if it's your neck and your back and you feel like it's super tight, rest can do more harm than good, because rest is making, or could be making, those joints even stiffer or tighter. So I would actually argue that the right type of movement will help heal you faster than rest. And one of the reasons I say that is because what I see when people try to rest, and I've talked to them during their inquiry sessions with me, when they're just trying to figure out what's going on and they want some answers, I find that many people have been resting for 2, 3, 4 weeks, and some people have been resting for 6 months to a year. If it isn't better in 10 days, I am telling you, you need to seek specialist help, because it's not going to get better on its own if it's not gotten better in 10 days. So I really encourage you, if you are experiencing emergency-like symptoms that I mentioned earlier in this video, if you are experiencing kind of urgent care symptoms like I mentioned earlier in this video, that you seek out a medical doctor, x-rays, MRIs, you get that stuff ruled out, because that is urgent or emergency. But if you are experiencing general aches and pains, and it's not better in 7 to 10 days, you need a musculoskeletal specialist, someone like myself, to walk you through. So that's why I offer complimentary inquiry sessions, just to have a chat with somebody to let them know what their next steps are. And when somebody reaches out to me on that free inquiry session, what they are going to learn is why they hurt. Yes, I'm actually going to give a treating diagnosis based on the symptoms that you are experiencing. And that can happen with me just looking at you through a video chat or listening to what you have to say. And then I can actually say, you know, based on those symptoms, I really do think that you need to get this looked at. Or, you know what, I think I can help you. And the other thing that you're going to learn through a complimentary inquiry session with me is we're actually going to go through a pain assessment. I'm going to take you through some movements, and you're going to figure out where your body hurts and where it actually feels good, because we can take those good movements and make the not so good movements feel much better. That is where movement is medicine, and that's why I have those programs in place. Movement is medicine. When you take action, and when you take the right action, your body can heal itself much faster than if you let time and rest do its thing. If you have any questions, go ahead and comment in the feed below. If you have people who have been suffering with chronic pain or have been resting for quite a period of time, go ahead and share this out to them. Just tag them in the feed as well, and that will give them some heads up on, hey, this video might be for you. I appreciate you tuning in. If you have questions, go ahead and private message me, or go ahead and comment in the feed below. If you would like to set up a complimentary inquiry screen, I encourage you, let's see if I can say that, a complimentary inquiry screen. If you'd like to set that up, go ahead and, again, private message me or comment in the feed, free screen, and I will be happy to get back with you. Thanks a lot, and I hope you enjoy the rest of your day.